Welcome to Doctor to the Garbage Pail Kids, the single best way to learn medicine after an accredited medical school has turned you down. I'm Matthew Tortora, and I'm a board-certified pathologist in New Jersey. And in this series, I'm going to diagnose the aches, pains, and other ailments of the characters from that all-at-once beloved and reviled iconic 80s trading card series, the Garbage Pail Kids. But before I begin, a quick disclaimer that the content on my site is for educational purposes only and does not substitute professional medical consultation with your actual doctor. If you'd like some general background information on what the Garbage Pail Kids are, feel free to check out my teaser installment listed in the link below. Otherwise, sit back and enjoy the course. Today we're going to talk about a young man named Windy Winston, card number 175A from the 5th series. If you're wondering about how he got his name, it's not because of his trumpet skills, but rather the violent burst of flatulence exploding from his backside, tearing the fabric off the back of his pants while his body hovers in midair, seeming to defy gravity. Now, I could go through a list of what his disease might be, but judging by the sweat pouring off of his embarrassed face, one disorder comes to mind: the irritable bowel syndrome, or IBS for short. What is IBS? Broadly speaking, it's pain and problems with your digestive tract. There are 4 different types of IBS: IBS with diarrhea, IBS with constipation, IBS which alternates between the two, and unsubtyped IBS for those that don't fit neatly into any category. What Windy Winston is suffering from is a frequent source of comic relief in the entertainment world. But for people in his shoes, it's anything but funny. IBS has been known since the late 19th century, and at that time the diagnosis was only made after sometimes extensive surgical exclusion. IBS remained poorly understood even into the 1970s. IBS is estimated to afflict up to 15% of the adult population in the US, and that number is increasing, and it's more common in women. Despite its high prevalence, less than 1/3 of all IBS sufferers will ever consult a doctor for their symptoms. Windy Winston is displaying one prominent and unfortunate symptom of IBS: flatulence. But there are myriad other symptoms he may also be experiencing, which include any and all of the following: diarrhea, constipation, loose mucoid stools, bloating, colicky abdominal pain relieved by bowel movements, painful bowel movements, a feeling of fullness even after having a bowel movement, and intolerance to certain foods. So what does cause IBS? IBS is what's known as a functional disorder, and its cause is not fully understood. A functional disorder is one in which there's no obvious anatomic abnormality to explain the problem. No surgery, no blood test, no biomarker, and no imaging study can adequately detect it. Our current understanding is that IBS is caused by a dysfunction of the nerves relating to gut motility, gut pain, and their connections to the brain. But why that happens is still not entirely clear. IBS sufferers often suffer from mental health challenges, the most frequent one being anxiety and anxiety disorder. Anxiety and stress exacerbate IBS, and IBS can in turn cause anxiety, embarrassment, and social discomfort. But anxiety, stress, and other mental health disorders don't actually cause IBS, although there is a strong link between anxiety and IBS. A number of foods can also trigger or exacerbate an IBS flare-up. These include fresh fruits and vegetables, gluten, onions, garlic, alcohol, caffeine, some dairy products, legumes, also known as beans, which may be good for your heart, but they're hell on your IBS. Most of these foods contain short-chain sugars, known as FODMAPs. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These sugars are very hard for the gut to digest and can worsen or trigger IBS symptoms such as flatulence, bloating, cramping, and loose stools. Symptoms such as blood in stools, weight loss, an abrupt onset, particularly after age 50, fever, and recurrent vomiting are not strictly associated with IBS and should prompt further investigation to rule out other diseases like inflammatory bowel disease, IBD for short, cancer, celiac disease, and other conditions. Unfortunately for Windy Winston, there is no cure for his IBS, but there are many ways to manage it. Perhaps the most important one is through diet, by avoiding the foods that trigger IBS symptoms, particularly those containing FODMAPs. Addressing one's mental health issues is also important in reducing the severity of IBS symptoms. As mentioned, anxiety and IBS are closely linked, and each can trigger the other in a vicious cycle. A highly effective tool to decrease anxiety and stress is exercise. Exercising consumes the chemicals that build up during stress and anxiety, and it helps release endorphins, chemicals that relax our minds, bodies, and guts. In some people, medications can improve IBS symptoms. Acetaminophen, branded Tylenol, and acetylsalicylic acid, also known as aspirin, can relieve bowel pain in IBS. Another class of drugs called antispasmodics can relax the smooth muscle lining the gut, decreasing abdominal pain and cramping. One example is dicyclomine, also known as Bentyl, but a more homeopathic yet equally potent example is concentrated peppermint oil pills. A medication called Lotrinex is available specifically to women with severe diarrhea-prevalent IBS, but it has a pretty bad side effect profile. A low dose of the antidepressant amitriptyline has also been used to block the signal between the brain and the overactive gut in IBS patients, although it should be noted that the benefit only occurs at quite low doses. Let's summarize the big points from today's session. IBS is a functional disease primarily affecting the bowel. Its cause is still unknown, but it can be triggered by anxiety, stress, and diet. It can't be cured, but it can be managed with proper attention to mental health, diet, and sometimes medications. IBS is a diagnosis of exclusion, so it's important to pay attention to unusual signs or symptoms to rule out other more significant diseases. Thank you for joining me for this episode of Doctor to the Garbage Pail Kids. I hope that I've managed to teach you a little something about medicine while rekindling your nostalgia for the 1980s. If you enjoyed what you saw, feel free to like, comment, share, and subscribe to my YouTube channel.